Welcome back to the Knee Pain Book Club. In this video, we'll be discussing chapters 12 through 18 of my colleague's book, The 90-Day Knee Arthritis Remedy. If you'd like to read along with me, it's available on Amazon in an ebook format. When most people with knee pain go to a doctor, a therapist, or a trainer, they're told they have faulty biomechanics, that they move incorrectly, and that this is causing their knee pain. Examples of faulty biomechanics include weak hip muscles, or anteverted hips, or kneecaps that don't track right, or pronated feet. You may have heard of some of these. But in chapter 13, there's a photo of an incredibly successful distance runner. Priska Jeptu is from Kenya and has won marathons in New York, London, and Paris. And when you look at that photo, well, it makes me cringe a little bit. I don't think you need an advanced degree in biomechanics to notice that her leg alignment isn't ideal. If you want to see her in action, there are several YouTube videos of her running. Her knees turn inward toward each other, and they cause her lower legs to kick out to the sides as she runs. It wouldn't surprise me if she had knee pain, but she doesn't. Now, it might be possible to finish a marathon with some knee pain. If you're finishing a marathon at top speeds, though, you're probably not having knee pain. I mean, Priska runs a marathon in just over 2 hours and 20 minutes. That's averaging less than a 5.5-minute mile. And she's competed at this high level for several years, making it even more clear that she's not in pain while she's doing so. Also in chapter 13, Dr. Kelsey cites a study of about 100 people, half of whom have knee pain, half don't. And they all had MRIs of their knees, and the 50 people with knee pain had kneecaps that were actually in better alignment than those without the knee pain. So abnormal biomechanics like Priska Jeptu's or in the research study, coupled with strong tissue, doesn't result in pain. But you can have normal mechanics, and if your tissue is weak, then you can get pain. So the take-home point is this: strength, flexibility, how you move may contribute to your knee pain, but they aren't the only cause of your knee pain, and probably not even the primary cause of your knee pain. This is really good news because some biomechanics can't be changed, like the position of your hip socket in your pelvis or the angle of your thigh bones, for example. Plus, how you move can improve if the pain goes away. So if you're limping because your knee hurts and you heal and strengthen your knee, then you'll likely stop limping and be able to use your hip muscles better. And this will result in better biomechanics. In chapter 14, Dr. Kelsey emphasizes again, quote, increasing your muscle strength is important, but to do that, you have to increase your joint strength first, end quote. He goes on to say that in order for joints to get stronger, they need to move and they need to be protected from too much force. This is true for knee injuries, both injuries that come on gradually and those that have occurred during a particular event or a trauma. As an aside, it's also a critical way to approach strengthening following injections like PRP that trigger your body to create new and eventually stronger tissues. Now, many of my clients with knee pain don't remember having a specific event, an accident or a fall or a particular impact while playing a sport that caused their knee pain. If this is the case for you, then chapter 15 will provide you with supportive insights into how knee joint pain can happen gradually. And then in chapter 16, that's a primer on pain. Doug Kelsey uses the analogy of pain as a check engine light. And as inconvenient as it feels, pain is trying to tell you something, to warn you that something isn't quite working right in your body. He states, quote, part of the answer is to know more about why you hurt, what to do about it, and roughly how long it takes to get better, end quote. But as he points out, just because you don't hurt doesn't mean there's not a problem that needs addressing. So your primary goal right now may be getting rid of your knee pain. But getting rid of your pain isn't the whole answer, because not having pain doesn't predict whether you'll be able to return to your desired activities without the pain returning also. In the next chapter, Dr. Kelsey shares 17 things he learned about pain. There are 3 that I'd like to highlight. The first one is number 6 on his list. Quote, the more you focus on pain, the worse it gets. This doesn't mean that you should ignore the pain, since pain is the check engine light. It means that you can use the pain to guide you to make choices that are different than the ones that caused the pain in the first place. Sometimes when I start to work with new clients, they have been ignoring their pain for such a long time, and this might be because it isn't clear to them why they have the pain or how to get better, or because they're hoping that it'll go away with time. In all these cases, I ask them to keep a log of their pain, and this helps us identify patterns of when they're getting pain, like maybe the day after they get 10,000 steps, or the day after gardening, or standing in the kitchen, or that type of thing. Tracking their pain helps them identify the culprits causing or maintaining their knee pain. And yet it sometimes feels to them when they start to track it like their pain is getting worse because of their increased focus on the pain. Thankfully, this is only a temporary sensation. If, on the other hand, you're not someone who ignores your pain, and instead you're hyper-focused on your pain because you're really trying hard to get rid of it, then you might feel comforted by the idea that your pain is going to feel worse because you're focused on it. It might feel even especially bad if you have any related fears. Questions like, will I need surgery? How long will I need to be off work? And one of the worst fears, what if this is something I have to live with for the rest of my life? These type of fears are like a microphone. They turn up the volume on your pain. The second thing about pain that I'd like to highlight is number 12 from Dr. Kelsey's list. Quote, pain forces you to be patient. The human body has certain principles and rules regarding healing. You can nudge the body along, but you can't force it to recover as fast as you want it to. End quote. This is a tough pill to swallow for many people. I frequently tell my clients that the hardest exercises are those that challenge their patience. Your patience will be getting stronger along with your joint. And lastly, number 17, pain can be exhausting. So if you're tired, keep this in mind, and it's okay to prioritize rest and sleep while you recover. It's actually very crucial that you do so. All right, the last chapter we're covering in this video is 18, chapter 18, in which Dr. Kelsey recommends that you rate your pain during and after certain activities, such as walking at a leisurely pace, walking briskly, climbing stairs, any type of squatting exercise, sitting, and standing. So you may not be limited by all of these, but I invite you to choose one or two that are an issue for you right now and rate your pain with each of them. Use a scale of 0 to 10, where 0 is no pain and 10 is severe pain. And be specific about how long you need to sit or stand or walk, or how many stairs you've taken when you're rating the pain for each of the activities. This will allow you to make similar comparisons a few weeks or a few months from now. Consider sharing your pain ratings in the comment section below. It might help someone else that's struggling with knee pain. Okay, that's all I have for chapters 12 through 18. I look forward to seeing you next week when we'll discuss chapters 19 through 23.